Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, awesome to have you here. We're having some incredible conversations with real leaders that are painstakingly reshaping the future of healthcare. And if you haven't had an opportunity to check out any of our historical interviews, wherever you are now, if you're watching this, if you're listening to this, please hit the subscribe button now. We're really passionate about a few different areas. We're passionate about access, innovation, transformation, and leadership. And the objective here, I'm just kind of taking a step back, is we're trying to get the real essence of people's stories. Not just the wins, the learnings as well, and sharing them with our community and ultimately with the world. So I am super excited about today's guest. But before I kind of dig in, what's actually really wild to me right now is that every health system in the country is buying AI, every single one of them. And yet, I think when you sit back and you ask many of them, like, how is it going? Like, how is it really, really going? The answer is usually like some version of the same thing. It's like, yeah, we've got tools and we're just not sure we have control anymore. Like, that's a real problem. And what I find fascinating about today's guest is that he has already solved a version of this problem before. It just wasn't in healthcare. So Dr. Justin Norden built a company called Trustworthy AI, and the whole thing was about making AI systems safe enough so you can actually trust them. And back in, I think it was HIMSS in 2023, sat around a table full of executives and tech leaders, and he listened to them. They were describing exactly what I just said. So they bought the tools, they just kind of lost the wheel. And maybe he can verify this, but it seems as though like him starting this company, he just couldn't stop himself from starting this company. And this company is called Qualified Health. They initially launched out of the gate. They had raised somewhere around like 30 million bucks. They just closed another round a little while ago. They go over 129 or something like that, just to keep me honest. But they're working with over a dozen health systems, really big names. You would know all those names, and he can mention them. But I think one of them had already documented some savings around like $15 million in under 6 months. That's amazing. Justin's a physician. He's a computer scientist. His CV is absolutely ridiculous. Stanford has been at Apple. He's also a venture capitalist at GSR Ventures. He was backing AI companies. So now he got an itch again. He's in the seat. He's seen healthcare from almost every single angle. And we're going to have him on the show. So, Justin, great to see you. Welcome to the show.
Well, Michael, thank you for having me. And let's be clear, I can live up to none of those wonderful, very kind words that you just said. So let's reset expectations, but
Yeah.
super looking forward to the conversation.
Before we get into anything like super serious, I got to ask you about something that I found out through one of your customers. And I think it's actually the most interesting thing that's on your bio. You're a three-time world champion in ultimate frisbee, Team USA captain, all-time assists and completions record for your team. Like, I need to know, like, how does someone who is doing all of that at the same time as medical school, building companies, actually, like, how the hell do you function? What's going on in your head?
Uh, so yes, I guess those things are all technically true. You pick a really niche sport. Key item one. I grew up playing everything. I have an older brother, every sport imaginable, baseball, basketball, soccer. Early on had a dream, like many, young boys do, be a professional athlete someday. Uh, I did not at the time think that would be ultimate frisbee, but ended up choosing college based on ultimate frisbee, based on some amazing coaches, and kind of falling into it on accident at the end of middle school and early high school. And then, you know, because it's not as serious, let's be frank, as a time
Okay.
commitment as some other sports, was able to compete through med school and after for quite some time. And so, no, an absolutely amazing uh, sport group of people, and was wonderful to keep something in your identity, especially through the hard years of medical training and things like that. But sadly, with new company starting qualified and with kind of now two babies, two kids. The cleats have been hung up for some time now. So maybe someday we'll go back.
I, I understand. The other thing I wanted to know is, look, you're a physician, you're a computer scientist. I think those are two different callings. Was there like a specific moment, maybe a patient, a professor, or even a problem that you ran into where those two worlds sort of collided and you thought, like, this is like where I need to be. Take me back to that.
Yeah. I guess it really starts first with my family. So I grew up in Seattle and came from a family of physicians. My father was a physician. My mom wasn't, but three of her siblings were. And
Okay.
so, like many, people who go into medicine, there's medicine was around. It was
Right.
never pushed by a family. It was never,
Hmm.
hey, you have to do this. But, as I was excited and wanted to learn more about science and things like that, there was support. But the other relevant piece was I, grew up in Seattle and went to what I'll call kind of the Bill Gates Microsoft grade school, high school,
Mm,
and was always interested in computers, built my own computers, early bits of programming. And, at the time we were, handed laptops in middle school, which at the time was
right.
weird, And so when I look back, these are kind of the two forces. I didn't know I was going to combine them at the time. I didn't know that
Right.
was going to be my career, but these were just two separate interests and ultimately, was going to do pre-med in college, but had an incredible professor who kind of convinced me to actually switch to study computer science
Mm.
as my major, which fulfills zero requirements, right, of the pre-med, curriculum, where if you do something like biology or chemistry, but
Yeah.
just had a truly incredible professor who went out of his way um, because I was interested, and it's no, I promise you this will come back someday to be useful. And that same professor convinced me to go out to England to a master's in machine learning and genomics. And then, you know, by this time now coming to Stanford for medical school, which was kind of the obvious choice, now trying to put these two
Yeah.
things together, um, that was kind of the start. Early, I thought it would more be on the research side. And that's what as a medical school. I did
Yeah.
cancer research, data science, computational biology work. Um, but I think the thing that really got to me in medical school was, incredible classmates who were going to do new basic science, develop new drugs. I was fascinated by that, but that wasn't me. I think
Right.
what drew me most was as you're there starting to learn about patient care, the thing that kind of would break my heart is all of these patients who came in for things we know how to solve in medicine. We just didn't do it for whatever reason. We know the guidelines, we have the drugs. It's not even about costs, which we could talk about. It was just people fell through the cracks. And
Hmm.
this was something that coming from a technology background and seeing these guidelines was something I was super drawn to. And that really kind of kept turning the cranks to Apple, our Center for Digital Health, building AI
Yeah.
tools into practice. And candidly, some of the work I'm most proud of we're doing today with our systems and partners is just closing this gap between what we know how to do and medicine has already figured out without a doubt and just getting it done across our
Yeah.
populations.
You've had such an interesting tour of duty because you've worked at Apple and some of these other places. And I know Apple is famously very secretive, and I'm not going to ask you to break any NDAs or anything like that. But what I want to know is through all of these tours of duty, what did they in essence sort of teach you about trust? Because your company has figured something out about trust that I think many companies don't ever like fully crack.
So I mean, it's funny. Trust is such a complicated word, and I'll
Yeah.
just describe a few dimensions for us. There's, we've known each other and had a handful of
Yeah.
conversations over the years and got to build a relationship and have many mutual friends. And so that's like one way to build trust. Another way to build trust is through data and performance. There's like algorithmic trust you can show with data, past performance, future performance, running things in shadow, evaluations. And so, and both are important, right? And I think often it gets conflated as one thing, but there's so many different dimensions to it. And so,
Yeah.
our and for healthcare, when the default is to not change, the default is to go slow on these new tools, to do no harm, to kind of overcome that when we're both in this industry because it is the most important industry. When you don't have your health,
Facts.
nothing else matters. And
True.
so it just, you have to treat it so carefully. It takes years and years to build up and an instant to lose.
Hmm.
And
Hmm.
so I think coming in kind of with this recognition of how important this is, it came from building the team super intentionally. One of my co-founders, Kedar Mate, is our chief medical officer. Again, he's been in healthcare his whole career, from CMS to IHI to running the IHI for the last 5 years. Is one of the most trusted institutions to work on the hardest problems, quality of care improvement, and change at health
Hmm.
systems. And it took, balancing the technology, one foot in the door on what is happening, at OpenAI, Anthropic, and the frontier labs, and what is happening on the ground in healthcare,
Hmm.
and being able to kind of merge these two. Again, being able to speak the language and coming from the context of years of working with healthcare, as well as kind of speak the language and be on point and trusted to stay up on kind of what's happening in the frontier labs. And so it really is the core of kind of how we've built the company, and how we've built our team, and then how we build kind of the tooling to kind of measure and show that we're doing what we said.
Yeah, this intentional curation, bringing the right people at the right time, is paramount. I want to make sure that the audience actually really gets like what qualified health is, not necessarily like the press release version, but like the real version. So if I'm a CIO and I'm calling you tomorrow, like what actually happens? Like what does that conversation look like? The weeks unfolding look like?
Yes. So a few things. I think, we consider ourselves, a really platform partner for health system AI deployments. So
Hmm.
what does that mean? If we're having a conversation with the CIO, one of the first things we can deploy is access to frontier models from OpenAI, Anthropic, Google, in a HIPAA compliant way, PII, PHI preserving, as well as training to now your entire workforce. This could roll out to 20, 50,000 employees, where,
Hmm.
you can prevent people from, using their phones, leaking patient information, as well as have kind of a single place people can get access to all the new models in a safe and secure way. So that's kind of one
Yeah.
product. The second thing, especially for the CIO lens, is we're getting the data infrastructure set up for scale. One of our core theses from starting the company is, instead of the CIO and the system having to do 50 different data integrations, security reviews, audit processes, contracting processes, um, to get access to some of the same sets of things, if we set up that data infrastructure once, we can now power tens, 50, hundreds of use cases, all based on that same modern infrastructure getting ready for AI with the same
Mm,
audit trails, monitoring, and governance attached to it. And so that's why, we call ourselves an infrastructure company, where we
yeah.
get that foundation set up right. And maybe my simple analogy for this is, it doesn't matter if your use case is a revenue cycle use case, a care quality management use case, an internal hospital operations use case. You need these three components: access to structured and unstructured information, ability to follow a set of rules, payer guidelines, clinical guidelines, hospital
Hmm.
operation guidelines, and then source for a user the exact data while a rule is followed, and then taking an action or allowing that user to take an action. It's the same thing technically over and over and over again. And so we've built the tooling, to really kind of deploy use case after use case in the same way that can be managed. So there's the data infrastructure work that we get set up, evaluation monitoring. There's the general purpose kind of employee workforce at scale, access
Hmm.
and training. And then there's kind of end-to-end workflows that we're building off of those same components to kind of
Mm.
really drive value scorecards for the chief medical officer, or really the CFO, to kind of prove those outcomes that we're searching for.
Yeah, I mean, I mentioned that one of your health system partners had documented $15 million, in impact in under 6 months. I'd love to hear that story, like to the degree that you're able to share, like what was broken before you got there, what did the team inside that system actually experience, and then what changed?
Yeah, so I think, this was one of our early partners, down in Texas, and I think, you know, how did the partnership start? I think they were really forward thinking in their leadership team. They were
Hmm.
starting to use these tools, experiment with these tools, and kind of wanted to make an early bet about where the world would go, and really wanted to partner
Yeah.
on, not a one-off, but really doing this at scale. And so that was really why there was a fit early to run at this. I think the other key component was we had leadership buy-in. It wasn't just the CIO, it was the CIO, the chief AI
Yeah.
officer, the CEO, the COO, the CFO, and we're able to pick problems that could move the needle, that they were measuring, and that we could show a delta for what that change looked like. And so a few things, I think the rollout started, like many of our others do, with kind of access to the frontier models for them around 15,000 plus employees, where people were able to, again, go to a safe place to get information, start to learn, start to kind of build some of their own tools, idea
Yeah.
generate different things as first component. One way, they talked about kind of what they might have purchased for something else, which was one way to think about
Right.
kind of the cost. But then the more interesting ones, we worked on a handful of revenue cycle problems. There's a few things the team had tracked where they knew they had gaps compared to kind of national benchmarks and guidelines, and we were able to kind of, again, use the AI system and those components to put something together to flag again to their users and to the team areas where um, they were kind of based on guidelines, missing opportunities to improve kind of what they were doing from a capture perspective, and submit that. And again, because we can track the very clear baselines, we're able to show kind of the performance and change over time. And then the final piece, which I'll mention, which I briefly mentioned a little bit before, and actually we've published on, was work we did with Anthropic and the UT folks to go through their patient populations in cardiology, specifically in heart failure, to start and show where there were gaps in changes on medications the patients really should have been on, which happens across the country. And again, just
Yeah.
because things are busy, chronic conditions, things fall through the cracks, as well as bring the patients in who really needed the biggest changes,
Hmm.
which again are the right things for the patients to kind of get the care and follow the guidelines that they need and kind of bring the most important patients and then prioritize those who really drive the economics for a health system as well. And so it's really one of these win-win-win things. We're able to bring in the right patients, prioritize those who really need, your specialist access to care and those limited resources, and prioritize that. And so, and then the fun part is this is just the start, because it's the same
Yeah.
infrastructure and tools that you just apply again and again and again on the next use case, because it is more work to set up the data infrastructure. It is more work to get to the strategic level with the leadership team to talk about their priorities and where it's a good fit. But then instead of bolting on one more solution, which adds even more overhead and even more cost and even more management
Yeah.
issues, we're putting it through that same foundation.
Yeah. It's like, listen, if you're going to build a skyscraper, you need to have a really sound, solid foundation. You're like, all right, let's do this. Let's do it once and let's build and go as quickly as we want. But we just know that we have the foundation to be able to support what it is that we're trying to do. Um, Maybe this hasn't been asked to you often, but there's so many companies that are out there, and a lot of them are, state. They do infrastructure and AI and this and that. How does how does someone sort of pick through the noise? I just feel like CIOs are so, in general, hospitals, they're inundated, bombarded with messages. Where do they distill what's real and what's not? What have you found to be sort of allows you to kind of cut through the noise? Because I would imagine sometimes even you, uh, despite, a stellar reputation, team, it's unbelievable, kind of get caught up in that sometimes.
It, this was one of the problems, as you mentioned, back to IMS 23 of hundreds and hundreds of companies popping up. How do we know
Yeah.
where to start, how to evaluate and run through? And I think, and this isn't a new AI problem. This has been true for decades in health
Yeah.
IT, as we've gone through health IT, digital health, are different names that our industry has evolved over time. And, um, at the end of the day, what actually happens, people want to talk to your customers and partners and hear results. You can have fancy marketing language, we haven't
Yeah.
done a lot. We don't have a marketing department. We don't have a marketing team. We don't even really have so unless we barely have a sales force, because and companies go at this in different ways, because the most important thing we do is deliver for our partners, period. And
Yeah. Your
especially at
customers are your
the
best
level that we're
salespeople.
doing. And I feel super fortunate in even how we do summer contracting. Like most of our fees are on the impacts that we generate together. where we win when they win. And it's an incredible group of partners who want to share, talk about their success, and really have a hand in what this journey looks like. And so, um, you know, I wish I had a perfect formula and, a team where, yes, you create, your perfect sandbox environment and have your whole team to do, evals and hundreds of different things coming in. And, while this is kind of one of the things, we can do internally, like health systems aren't set up for that at scale. And by the time you
Yeah.
set it up right, the models are changing and we want access to more information. And by the time you've tested properly and integrated with someone's new system, you've spent, you know,
Mm, mm.
hundreds of thousands of dollars just in the process, and people power to get to that endpoint. And so, really this is why, we focus so much on being able to deliver for our partners because those customer references are everything.
Yeah. Look, at the end of the day, what you say is never going to be as valuable as what someone else says about you. And if it's a customer who's delighted, it is worth its weight in gold. That's for sure. Um, Before we kind of wrap, I just wanted to, so where can people follow your work? You mentioned you don't have a robust marketing department, but like where do people kind of follow the qualified health story? Give a shout out, give a little commercial for that before we end up wrapping.
Yeah, I think you know, we have a website, qualifiedhealthai.com. We have our LinkedIn page, as well as, it's the only place I'm really active. I do, posting on LinkedIn from time to time. As again, it's not just things about us, it's really about where the field is moving. I still do a podcast for Stanford on healthcare AI, and it's really a conversation on what's happening, new papers, new developments coming out that isn't related to qualified health, actually. It's just about how
Yeah.
do we keep up on the field and the conversations that are happening. And so those are the places. Please feel free to reach out if you're a health system listener and want to have this conversation in more depth. But it really is just an exciting moment when healthcare can change. The tools are available now to do so. And now is about how do you partner and put the pieces together and work through the changes to our institutions, and systems that will come of it.
How far out do you look, as CEO? Because obviously you're a part of a fast-growing company, there's a lot going on. And I ask that question just because if you try to peer out 5 years, 10 years, and if things are going according to plan in terms of how you can impact American healthcare, how different does it look? How does it impact the person in the waiting room? Like, talk to me about that vision.
So 10 years is too long. I guess I'll start there.
Five years. I mean, I listen, 10
It's
years is
too
hard
no,
to look at.
it's too far, which in healthcare people often will argue is not too far, but at least I'm on one side sitting in Silicon Valley, 10 years is too far.
Okay.
Uh in There's a few different ways kind of I think about it. Take this work on, care gaps that we do and improving quality of care and guidelines. We focus on cardiology first, but we're going to do this across everything. What happens when you have proactive, guideline-driven care on every single patient? How does that change who you see, your triage, your throughput? Like
Mhm.
these are questions we should be answering now. It'll take a couple years to get that through the systems and for those to evolve, but it fundamentally looks different, right? Even as you start thinking as we have these tools or someone else builds these tools, you know, how you think about a capital investment on a building starts to change, right? From a health system. How you think about a workforce that's using these tools on a daily basis. And OpenAI published a paper last week internally at OpenAI. It's not just their engineers anymore, it's legal, finance,
Mhm.
customer support that has switched all of their workflows from chat-based interactions really to agent-based interactions to offload tasks. These things are happening now. And I think
Yeah.
the difference between systems who choose to treat AI as how they run the business versus as a project within 2 years are going to be pretty different. And, I walk, system partners through, what is the margin level impact? How much can we change quality of care? And um, as I kind of talk through these numbers, forget AI, there's a 3 to 5% margin change if leaders just did all the things that they wanted to do and get done, what they would typically hire a McKinsey for. then you start to layer on kind of the impact of AI and revenue cycle, care gaps, all these other places where it
Yeah.
truly can kind of change how a task is done. And there's at least another 3 to 5%. McKinsey has an 11 to 19% paper that they published last week. But this is possible now. Forget new models, forget all the,
Yeah.
hype coming out from Silicon Valley on what might come. That's just today. And so it really, that is possible today. And we're starting to prove that with different partners for kind of when we really think systematically about knocking these things out. And so within this year, we're going to start to see more results where systems are truly finding ROI and changing. By the end of next year, I think systems are going to start to pull away. Um, but in other places, healthcare will be exactly identical. And so I think this
Yeah.
is the interesting conundrum of as we watch US healthcare, but I think you'll start to break away into two packs starting this year. And then really by the end of next year, systems are going to start to look different. And it's going to
So
show
you
up
think
on
it'll be
clinical
kind of
quality and financials.
they're kind of K-shaped, basically the ones that are going to take are going to be dramatically better and the ones are just going to that are not on board with this. Because the way that you mentioned it's like, hey, this is the new operating system and you're integrating it. You're not just you said it's not just a project. You're like, no, no, this is a completely kind of embedded operating system of doing things. Fascinating.
That's correct. Again, super biased on one end of the spectrum, but getting to work with leaders who see what's coming and get to do that, I just feel so fortunate to get to do that every day, and the improvements are starting to build up, and it's super exciting.
Justin, is awesome having you come on. I just love how bold you are in terms of like the work that you're doing. You're getting out there, making it happen. I see you on the road all the time. So we're both on the road. So it's good to run into each other and seeing it happen. I don't say that lightly. So for those that have been listening, if you found this conversation interesting, or if there's another leader that you would like for us to have come on to the show or a topic that you want us to explore, leave a note, leave a comment. And if you found this particular conversation to be enlightening, please share it, like it. If you haven't subscribed, make sure you subscribe now because it is important. This is an interactive community. So thank you for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show.